of the spine, and that's actually a release of carbon dioxide from the joint space as the joint becomes more loose or opens up. But there's also soft tissue techniques and muscle energy techniques, isometric techniques, craniopsychotherapy. So there are many different types of therapies involved with just articulating the spine, increasing mobility and flexibility.
So I kind of was on the right path there with the cracking the spine. Why is it important in some cases, I guess, to get the carbon monoxide out of the joints?
We're not really sure why that is. We just know that there's a sound that happens when we do the adjustments, and some people think it's bone on bone or tendon on ligament or whatever. But we found out that we think anyway, that it's the carbon dioxide being released from the joint. So whenever you have any type of metabolism or respiration going on, you have either the production of carbon dioxide or the production of oxygen. So in the human body, we use oxygen and we produce carbon dioxide as a byproduct. So it's possible that as we go through our daily life that we have a buildup of carbon dioxide in either the spine, the joint, or in the blood vessels and muscles. And as we start doing the articulation of the spine, it's released from the joint structure.
And we're here with Dr. Darin Bush. He's with Mobility Spine and Sports. That's his office located in Fort Lauderdale. I'm going to give out the info here in a second. Board-certified family medicine, osteopathic manipulation, which we're talking a little bit about, and pain medicine, which we're definitely going to talk about here in the next few minutes. Now, Dr. Bush, I know that Mobility Spine and Sports, it kind of sounds more of like a orthopedic practice, but you have the training and the knowledge, I guess, to treat the body from head to toe?
That's correct. My initial board certification and training is as an osteopathic family medicine doctor. So I'm taught to evaluate the body from the inside out, if you will, from internal medicine or family medicine standpoint. And then my specialty and subspecialty are in essentially non-surgical orthopedics, very similar to what a physiatrist or a physical therapist might do. So I'm able to evaluate the body from a medical standpoint with the family practice background, the osteopathic background, and the orthopedic background from the DO training.
And so tell me about, like, how busy is your practice for, like, lower back pain versus people walking in with maybe a virus or a chronic condition?
Most of the patients who walk through my doors come in for some type of, again, an itis or anosis, some type of ache or pain. And generally, they end up becoming part of the family. They end up sort of sticking with us. And so nobody really comes in just for back pain. They initially come in for back pain, but then they say, oh, I also have the shoulder pain or I have an ankle pain. So we end up essentially treating everything in-house from their orthopedic, osteopathic dysfunctions all the way down to the common cold.
So they can see you for everything.
They can. I really like to treat the non-surgical stuff, but if they've got a common cold or they've got a little bit of diabetes that needs to be managed, I can do that on the side as well.
And one of the things you mentioned is pain, and I know that on your website, it's mobilityspineandsports.com. You can find out a ton of information about Dr. Darin Bush there. The number's 954-414-7080. I'll give out the address a little bit later. But you do a lot of interventional pain procedures actually in the office. This isn't done in the office setting. Tell us a little bit about these interventional pain procedures and how they can help people, live a life free of pain.
Okay. So whenever you have pain, our body has a natural way of healing itself. The problem is every once in a while it runs into problems where it's not getting enough vascular flow or it's not getting enough nerve flow. So a lot of doctors and a lot of people across the planet, essentially when they have pain, they'll take a pill. Well, whenever you take a pill, it's got to go through the digestive tract, it's got to go through the kidneys, the liver, and only about 5% of the medication actually ever reaches the organ that you want it to, being the muscle or the spine. My theory in a lot of interventional theories, if you have a pain syndrome, take the medication and deliver exactly to where the problem is. Inject it there. So we do that in the office, whether it's a basic trigger point or joint injections, or we do much more complex injections such as facet blocks or prolotherapy or sacroiliac injections, epidurals, that kind of stuff as well. So almost every patient that walks through my door will end up at some point being an interventional patient, because I really truly believe that the best way to get the body to heal itself is to deliver the anti-inflammatory medication to the area that's inflamed. If you can get it to the area that's inflamed, you calm down the inflammation, you reintroduce blood flow, you get nutrients and oxygen to the area, and the body can start healing itself.
Now, it's one of the main reasons people benefit from interventional pain procedures arthritis? Is that one of the main reasons that you're able to help them with that?
Yeah, arthritis it's sort of like the word sciatica. It's come to mean a lot of things in society. So arth meaning joint, itis meaning inflammation. So almost all of us have arthritis. So whether it's a shoulder pain or back pain, we all have arthritis. So yes, 99% of my patients who come in do have some sort of arthritis, but it's much more specific than that.
What actually is arthritis? Is it something that develops over time? The joint is kind of breaking down in a way?
Well, there's different types of arthritis. There's generalized osteoarthritis, which is just a natural inflammation of the joint and degeneration of the joint, which comes with aging and also with trauma. And then there's also rheumatoid arthritis, which is another type of arthritis that breaks down the cartilage. Our body sort of attacks itself and breaks down the cartilage. So both of them are a degenerative change in the joint structure, whereas you lose the gelatinous structure or the capsules and that type of thing, and you lose joint space, therefore restricting range of motion.
And one of the things I'm looking on the website right now, it's mobilityspineandsports.com, fluoroscopic guided facet injections. Is that using X-ray to actually pinpoint the exact location?
Yes.
Where to make the...
Yeah, a fluoroscope, or a lot of people call it a C-arm. A fluoroscope is essentially a live X-ray or a CT scan, and we do that in the office. It allows us to visualize where we're putting the injection, the depth that we're putting the injection, and also at the same time it allows us to analyze the anatomic structure.
And same thing, ultrasound guided injections. This is getting very to the pinpoint, precise location.
Ultrasound is different from facets. Facets is very much like X-ray or CT scan, which is two-dimensional. Using musculoskeletal ultrasound is actually three-dimensional. So you're actually seeing live feed. You're seeing the actual true depth and whatnot. So you're actually getting a more specific and direct way of analyzing the anatomy and injecting the injections.
Now, also Botox injections, you do those in your office, and what are some of the ailments that can help?
So we use botulism, or different types of that would be Botox or Dysport, and we use that for the treatment of chronic migraines, also for dystonia, chronic muscle spasms, doing it somewhat in people with something called torticollis, or which is another type of cervical dystonia. So chronic migraines, dystonia, muscle spasm, and we're also using it for cosmetic purposes.
Oh, wow. And that'll go into a question I have for you in a little bit.
Absolutely.
We're here with Dr. Darin Bush. He is a family practice, but also osteopathic manipulation and pain management physician. His website is Mobility Spine and Sports, and the number's 954-414-7080. Now, we talked a little bit about interventional pain procedures that can be done right in your office. Now, do you take insurance for those treatments?
We absolutely do. We accept Medicare. We currently are in network for Cigna and United Healthcare. Some work comp plans, auto accident cases as well. And we are considered out of network for both Aetna as well as Blue Cross Blue Shield.
Okay, I know those names. Those are all very common insurance companies. And you list the insurances actually on your website. There's a tab there that people can click and see those names of those insurances to kind of find out beforehand.
And if there's ever any question, they can call the office and talk to the girls at the front desk. They're very, very helpful to let them know or find out what the benefits are for the patient.
And I'll second that. I talked to Carol today on the phone a few times, and
Carol's awesome.
She was great and helped me out. And to get you right here so we could ask you all these great questions on this adventure of health. I have a couple minutes before I take a break.
Okay.
Take us kind of on a virtual tour of your office. I know the building. I have to stop by and say hello and come into your actual office. But this is that iconic round building over in Fort Lauderdale. And I know a few movies have been filmed outside there on location. I meant to look them up, but I didn't get to it. But it's 3101 North Federal Highway, Suite 201, Fort Lauderdale, Florida. 33306 is the zip code. Tell us a little bit about it. It's that iconic round building at the corner of Oakland Park Boulevard and US 1.
Yeah, so it was built back in the 1950s and 60s, and that's prior to sort of the boom that we're seeing in South Florida right now. So it was really an eyesore at first when it went up. It's a round building. It looks very much like it came out of the Jeffersons cartoon. It's round, it's tall, it's bright colored. But it's become a sort of a landmark to the area. A lot of films have been shot there, some professional and some home movies, so I hear. It's got a lot of a definite history, and it's right there on the corner of Federal Highway in Oakland Park Boulevard, across from Target, if you will. And there's a lot of different types of things inside of the building itself. Citibank is on the first floor. But the most important one, of course, is us, who we're on the second floor. But it's a very, very interesting location. It's got a great story behind it. It's become a landmark in Fort Lauderdale. So it's easy to find.
Easy to get in and out of, parking, convenient.
Very, very easy. It's got a large parking lot with overflow parking as well.
Yeah, I imagine because you treat a lot of patients with pain, I mean, it's got to be something that conveniently, can be accessible.
Yeah, there's plenty of handicapped or disabled parkings around the building, and just in general, it's a large parking lot and it's easy to get to. There's elevators. We're located on the second floor, so there are elevators to get to us as well.
That's good to know in a very busy area of Fort Lauderdale there, but easy to get in and out of. Again, Dr. Bush's mobility, spine, and sports practice, his office is located at 3101 North Federal Highway, Suite 201, Fort Lauderdale. Let's take a quick break, and on the other side, we're going to talk more to Dr. Darin Bush, family medicine, osteopathic manipulation, and pain medicine doctor on the How to Stay Healthy show. How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m., right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments. And my curveball question of the hobbies and passions in life doctors pursue when not providing medicine.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And we're here with Dr. Darin Bush, board certified in family medicine, osteopathic manipulation, and pain medicine. Dr. Bush, I don't run into many doctors that have that kind of certification, so that's very unique. That's great. Tell me a little bit about, though, your education and training. How did you get here?
I did my undergraduate at the University of New England in Biddeford, Maine, an awesome place to go to school and live. And then I didn't even know about osteopathic medicine at the time. I was planning on becoming a doctor since I was, 6. And then I just met a bunch of the medical students on campus who were just really interesting people. Definitely, they sort of they thought outside of the box. And I got to know them a little bit, and then I learned about osteopathic medicine. So I applied to that school. I went to the University of New England College of Osteopathic Medicine in Biddeford, Maine. And from there, I went to, I finished my medical school in Maine. And then I went and did rotations throughout the United States. I was at 19 different hospitals in 7 different states during my school time for rotations. And then I did my residency in Tampa, Florida, my internship and my residency in Tampa. And then I settled on my specialty, and then ended up falling in love with a practice in Fort Lauderdale, Florida, a mentor of mine. And then I joined him after residency and got certified in pain, and everything is history from there.
19 different hospitals. Wow, that's I haven't heard that before. Now, you were chief resident in Tampa, though, as well, though.
I was.
That's very important, definitely. Now, also, let me ask you, what brought you down to South Florida? What brought you down to Tampa the first place, then over to Fort Lauderdale?
Honest answer, I was doing rotations as a medical student in Brooklyn, New York. And I was loving life, and I had signed a contract actually in Worcester, Massachusetts, to do my residency. And I had 2 months left of medical school, and a friend of mine said, dude, you're working way too hard. You need to go to Fort Lauderdale. There's this cool doctor there. You'll love the practice, and you get to go to the beach a lot. So I came down in May of 2000, and I fell in love with the practice, and ultimately ended up joining the practice.
Now, going back there a second, you were telling me before we came on, when you did medical school, University of New England, osteopathic medicine in Biddeford, Maine, you stayed at a beach house with some other med students as well?
Yeah, Maine is a beautiful state. It's under snow about 10 months out of the year. So there's a lot of beachfront properties. So the owners rent their beach places out to students. So I had another friend of mine from actually high school who was in medical school, and we shared a beach house for essentially the 4 years of medical school.
That's really neat. That must have been something else.
It was incredible.
Well, that would have been a good reality show back in the day.
Yes, absolutely.
Med students on the beach in Maine.
Maybe a little boring. It's just a lot of studying.
Oh, really?
Drinking beer maybe once every 6 weeks.
Oh, wow.
Yeah.
Definitely. Well, thanks for sharing that. And you're board certified, like I said a few times, in family medicine, osteopathic manipulation, and pain medicine as well. Why did you decide to become a doctor?
It sort of chose me. I always have been great at science and great at math, and I just always had a love for it. And I think maybe somebody told me when I was in 7th grade that I was going to be a doctor, and it just stuck. And I never thought about anything else other than that. So it was just programmed in me. I come from a family of healers. I'm a physician. My twin brother's a physician. My sister's a nurse. I have a brother who is an organic food farmer. So we all just sort of are natural healers, and so I just sort of fell into it.
Where are you originally from?
I'm originally from a town called Lowville, New York, which is in upstate New York. It's about 45 minutes from Canada. When I say upstate New York, people from New York City think Westchester, but I'm about 5.5 hours north of there, so pretty much Canada.
Yeah, way up there. Wow. And your twin brother, you said, is a physician?
Yeah, I have an identical twin brother who's actually a chiropractor in Oneida, New York, in upstate New York.
And a sister who's a nurse?
A sister who just graduated from nursing school.
Wow, that's fantastic.
Yeah.
That's really great. That is a family of medicine there. Definitely. Now, we're here with Dr. Darin Bush, interventional pain procedures, treatments for anything associated with family medicine, pain medicine as well. You also have a center for anti-aging at your office. Tell us a little bit about the Center for Anti-Aging.
So, as we all age, we all sort of want to not age. And part of the overall treatment for pain and just overall health is to make sure that we have a normal balance of hormones and a low level of stress. So we analyze people's hormones. We look at their testosterone, their DHEA, their cortisol levels, their estrogen levels, and just see where they're functioning. Also the thyroid. And I believe in supplementing people's hormones into what I call the optimal range of normalcy. I don't believe in a true normal range for hormones, because if you look at testosterone, the range is really from 200 to 1100 in a man. So why be 201 when you can be, say, 910 with much more energy? So the 910 would be more the optimal range. So we evaluate people from the inside out. We look at all their hormones, and then we make a plan that's very, very specific to each patient. And then we modulate their hormones, whether it's through pellet implants with testosterone and estrogen, or through injectables or compounded creams, whatever works best for the patient's lifestyle.
In terms of anti-aging, how many? What's the percentage of women that you're seeing for? What's the percentage of men that walk through your door? Are a lot of what I'm getting to is are a lot of men nowadays coming and asking for anti-aging?
It's men's health is still not pushed far enough. Insurance companies really don't support men's health, and the community doesn't really advertise it. But men are starting to become more proactive in our health. Men, we're sort of a little bit stubborn. Women, if they hear a creak, they're at the doctor right away, and they want to stay ahead of it. Men, if we hear a creak, we wait till it becomes a thump, and then we go get evaluated. So men are starting to become more knowledgeable that we can take care of ourselves, and we can modulate our hormones and do that kind of thing to stay healthy. And they're even getting involved now with fillers and Botox and really sort of catching up to where we need to be, which is close to where women think about their health.
And in South Florida, where it's in the area of Miami, Fort Lauderdale, West Palm Beach is going through an amazing renaissance. Everyone's on the beach on the weekends. They're out on the boat. They're all over the place. It's like fun in the sun, and and here's an opportunity to maybe look your best. A doctor who does it all and
feel your best.
Yeah, and feel your best as well. So that's important.
It starts on the inside out. Health starts really on the inside. We can do as much as we want to our exterior, but it really starts on the inside, and that's adequate nutrition and taking care of ourselves and making sure our hormones are where they need to be, and that we're able to balance out our life with our stress levels. It starts inside and out, and if we can be great on the inside, then we can feel great on the outside.
I want to come full circle back a little bit to interventional pain procedures and the treatments and ailments that you treat. One of the newest things you're doing, we always like to ask doctors who are on this show, what's new. And you were telling me a little bit about Epad.
Yes, Epad is extracorporeal pulse. It's essentially, we're using shock waves, and Epad was originally developed for the treatment lithotripsy for people who have kidney stones, and it's essentially shock waves that are used to blast up, in the case of lithotripsy, blast up the stones into small particles so that they can be excreted through the kidneys. In musculoskeletal medicine, we're using them again for the itises and the osises. We're taking it's about 10 times less strong as the lithotripsy, but we're using it to treat bursitis of the shoulders, adhesive capsulitis, spondylosis of the spine, epicondylitis or tennis elbow, plantar fasciitis, and we're using it, and by blasting these shock waves through the tissue into the attachments of the ligaments and the tendons, we're increasing the blood flow. Again, we're reintroducing the nutrition and the oxygen into the area, stimulating the body to produce new cartilage, healthier tissue, and patients are getting better much, much quicker.
Now, the Epad treatments, how long do they take, and how often will I need to have them?
One treatment takes about 5 minutes, and you generally have to get 3 treatments done 1 week apart.
Okay, that's quick. So someone can come maybe on a break from work in the morning, on a lunch break, maybe after work if they get out.
Absolutely. The initial evaluation takes maybe 10 minutes, and the treatment actually takes less than 5 minutes.
And what about for interventional pain procedures? I know it's kind of a broad question. There's a lot of them that you do, and you can find all those on mobilityspineandsports.com. But what is the normal range? Say I have one today, when would I have to come back and see it to keep it up, to keep away from that?
So depending on what we're doing, so say we're doing facet blocks for somebody who has severe acute pain or chronic pain in the spine, we may only have to do that once. And the procedure, the evaluation, everything takes probably about an hour to an hour and a half. And that may not have to be repeated. If we do prolotherapy or proliferative therapy, or if we do PRP, those are types of treatments that we probably have to we will repeat once or twice over the 3 to 8 week period.
And I know PRP is, I asked you last time, and I did my homework, it's platelet-rich plasma injections.
Yes.
So you take, just briefly, blood out of the patient's body in a certain area, spin it in a centrifuge.
Very, very good, yes.
And then it's put back in, and there's a special chemistry of that blood that kind of helps the ailments.
We take about 50 cc's of your blood, we spin it down in a centrifuge, it separates it out into about 3 or 6 cc's of what's called platelet-rich plasma. We inject that back into the injured area, which reintroduces healthy blood and stem cells, and it stimulates the body to regenerate.
Unbelievable. Thank you for sharing so much about your osteopathic practice on the How to Stay Healthy show. Check him out, Dr. Darin Bush, Mobility, Spine, and Sports. Thanks again, Dr. Bush.
Thank you, David.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.